They're on hormone replacement, they've had strokes, they've had heart attacks, they're anorexic, they're bulimic, they're on steroids, they're bodybuilders, they're couch potatoes, you understand? They're on high blood pressure medications, and they take all these very sick and healthy people and they put them into a bell curve. And they're analyzing those low and high ranges as what's right for you. That's not right for you. The ranges that we use are called functional ranges. And a functional range, for instance, like with your thyroid, your TSH, one lab says it's the low of the TSH is 0.20, the high is 5.0. Another lab says 0.50 is the low and 5.0 is the high. The ranges that I use are coming from the real Endocrine Society research experts called the American Academy of Clinical Endocrinologists. They're the ones who say that the TSH range should be between 1.8 and 3.0. If it's anywhere below or above that, you're having malfunctions go on. If your doctor looked at your thyroid and said it's normal, maybe it's not normal. Maybe they're missing the boat, okay? So we've got to do a complete blood analysis with you. We can assess kidney function. We can assess if there's bacterial or viral or parasite infections in there by looking at the white blood cells. We'll understand completely what's going on. Your blood sugar levels are very important. People who've come in who've been told they have fibromyalgia and they're so fatigued, simply it's because their blood sugar was maybe at 75 or 80. And for that person's body, that was too low. We had to regulate their blood sugars in their body by proper dietary habits, being informed and instilled with them, and rerunning their blood tests within a month, and making sure that we are watching those markers and helping them get well. And I've seen those chronic fatigue cases just disappear, sometimes just by making sure their blood sugars are in the normal functional range. Our ranges for glucose is 85 to 99. Your lab says 65 to 99. If it falls below 85, you're getting a reaction, a reactive hypoglycemia pattern. If your blood sugar is above 99, anywhere between 100 and 126, you're getting what's called insulin resistance, or you have insulin resistance. Your cells are not allowing the sugars to come in to the cell to allow your brain to use sugar for energy later. Your brain eats sugar for energy. If your brain can't get it because you're insulin resistant, insulin puts sugar into your cell for the cell to feed the brain later. If you're insulin resistant or pre-diabetic, that's a problem, even if the blood sugar number says 104, because this will cause another hormone imbalance. Whenever we have something called insulin resistance, we have an enzyme upregulation in the body that makes a man's hormones more like a female. I'm not saying you're turning into a woman, but your testosterone in a male will become more like an estrogen, and in a female, what happens, whether you're premenopausal or postmenopausal, your hormones, you get this enzyme called 1720 lyase that comes up in the body, and it will cause your female hormone, estrogen, to become more like testosterone in the system. I find testosterone dominance in females all the time. We've got to be able to figure out if it's caused by a blood sugar problem that's going on in your body. And we can do that and help you. If you're diabetic, right there, that's an alarm. Get those sugars down. It's very important. And we've got to get those under control because your brain needs regular blood sugars to be normal. Fibromyalgia cases all the time find relief just because we're getting blood sugars normalized. 4 priorities when I look at blood is anemia, is blood sugar, is gastrointestinal, liver, is fatty acid metabolism, and we also look at what's called the ASI, adrenal stress index. If you're anemic, if your iron's low, you can't get oxygen to the brain. If the B12 or B6 is low, you're not getting proper fuel supply to the brain. Your brain needs oxygen, it needs blood sugar, and it needs stimulation. Adrenal stress index is so important. For the fibromyalgia cases that are chronic fatigue and insomnia, this test is a must. We do have a saliva test that we run that does a 24-hour circadian rhythm of your adrenal hormones. We're looking for one in particular, it's called cortisol. See, in order for your brain to sleep at night, it needs proper cortisol production to produce the melatonin, to deal with the melatonin production in the brain. If your brain at night is not getting the proper sugar supply because the adrenal gland is so exhausted and it can't produce the hormone called cortisol to find the sugar in your cells, to bring it up to your brain, to allow the brain to eat at night, and your brain eats every 15 minutes when you're sleeping, if that brain can't get its fuel, you can't sleep. If your brain is hungry, it's not going to let you rest. We've got to check your adrenal test. We do expanded male or expanded female hormone profiles. If you're a woman who's cycling, we don't just run one spot blood test on one day in the month. We run a whole cycle of the hormone test. We've got to check 11 periods within your month what's going on with different hormones like follicle-stimulating hormone, luteinizing hormone, estrogen, estradiol 1, 2, and 3, testosterone, progesterone. We've got to find out, and DHEA, we've got to find out where you are going through your cycle. It's not just on one spot in one day. You're going to be tested throughout the whole cycle to understand where the highs and lows and abnormalities are. If it's in a postmenopausal woman, we've got to check all the hormones from brain down to the ovaries and everything in between. Pituitary gland, thyroid, down to the ovaries. Because the only way you're really going to understand if your hormones are out of order and what pattern they're in is by running an expanded female hormone profile. Okay? And that we can get into order. And these hormone panels are really important because you may have mental fogginess that's caused by this. You may have mental fogginess, you may have fatigue, you may have mood swings, you may have weight gain or weight loss you may not be able to explain, and it's all caused by irregular hormone panels. One of the most important things that we find with people with fibro is the immune system. And your immune system is really important. We've got to put it into a certain category. You're either going to be a Th1 or Th2 immune problem. And the Th1 or Th2 is going to tell me that some things that you think are okay, like echinacea for a cold, might be bad for you. Caffeine might be bad for you. Mushrooms might be bad for you. But you don't know until you get that immune system test. We run what's called cytokine testing. We run what's called a lymphocyte subpopulation analysis. And we run what's called natural killer cell activity. We've got to understand, do you have an active antigen response? Is your body constantly fighting something in the intestinal system or in the bloodstream that we've got to fix and suppress? Is your body have an immune dysregulation pattern? Is it just fatigued and it doesn't know how to fight the battle anymore that we've got to fix? We're going to do that with that lymphocyte subpopulation analysis. Then we also run the natural killer cell activity because we've got to understand what pattern the immune system is in. When the immune system is flared up, when the immune system is fighting a battle that it's just not winning, it's going to stress your nervous system, it's going to stress your endocrine system. Put the pieces of the puzzle together and you'll be able to figure this out. The best indicator for an active antigen or an immune dysregulation is by looking at what we call the CD4 to CD8 ratio on this blood test. Okay, so 3 very important immune blood tests. Brain-based therapy. Now that we've covered the metabolic side of things, stool analysis, 3 kinds, liver analysis, thyroid complete analysis, complete blood analysis, adrenal stress index, hormone analysis, that immune study, but then we get into brain analysis. We're going to check on the different areas of your brain. Mental fogginess, clarity by the temporal lobe. I can't find my words. I've got this brain fog. I can't speak. Or I'm losing feeling in my hands or my feet. We're looking at different areas of the brain that control the functions of your body through a functional brain-based assessment. It's the most amazing thing I've ever done in my practice, and I see the results are truly, truly amazing. We use this test called Realize. There's an infrared camera that goes over one eye. We test for nystagmus. If the brain is not functioning well, the eyes won't function well. Not near and far side of vision, brain muscular control of the eye. We check brain hemisphericities by right and left hemisphere using an interactive metronome test. We check for neurotransmitters, brain chemistries. We check for oxygen levels. We do a blind spot test right in front of you on your first consultation. We'll do that and see if your brain is functioning normally through the eye function. And when we treat here, we test, we treat, and we retest to make sure that what we're doing is working. We retest blood tests, stool tests, we retest brain functional tests. You can be better. You've got to understand that there is a real, complete, comprehensive way to analyze yourself. We do exercise with oxygen. We do vibration therapy, auriculotherapy, unilateral adjustments. We have an antioxidant called glutathione. We go a very comprehensive metabolic and neurological assessment and treatment program. Okay? What I invite you to do is first to ask you these questions. Ask yourself, how has fibromyalgia affected my relationships, my life? How much has it cost me in time, in sleep, in vacation? Where do I picture myself to be in the next few years? And what is it worth to you if we could figure this out? I invite you to put your information. If you look on the screen where you're watching this video, there's a box at the bottom to put your name, put your information in there. We'll get in touch with you. We'll send you a packet of information in the mail. That's a very complete assessment package, and we'll be able to set an appointment for you. I invite you to fill those out, and I look forward to meeting you and helping you and going over all of this information in greater detail for your individual fibromyalgia condition. I look forward to meeting you. Thank you.